So we're going to shift gears now and talk about health care debate, because could the abortion debate be part of something that derails the conversation, that silver bullet that kills health care reform? And how did it get into the debate anyway? Last night, a House committee approved and then defeated an amendment that would limit abortion coverage. So let's bring in Democratic Congressman Tim Ryan of Ohio, and also joining us, Cece Conley, health care reporter for The Washington Post. Representative Ryan, let me start with you. In 1976, the Hyde Amendment was passed, basically saying that public funds can't be used for abortions. So why even confuse the issue, putting in language that, frankly, for a lot of people, just doesn't seem like it's necessary?
Well, there's going to be a lot of public subsidies in this plan for poor, moderate, middle-class Americans to be able to afford health care. And I think anytime you have this level of public funding being a part of the health care debate, that issues like this come up. But I think this issue last night in the committee was resolved. There's going to be no public funding for abortions, and I think that's the goal that a lot of us had, and that's the goal that was achieved.
Cece, the president has called this a distraction.
Yes, I think that many people would argue that this is something of a side issue compared to the much larger health care overhaul that's being debated up in Congress. Clearly, there are some people who feel that this is important and needs to be aired and be a part of it. Others argue it's a side issue. So it really depends sort of on where you're coming from, Doctor. Of course, the difficulty here is that many insurance plans today, private insurance plans, do cover the medical procedure known as abortion, as well as other reproductive rights. The federal employees' health insurance program does not cover that. So there's a wide variation already out in the country when it comes to health insurance coverage.
Representative Ryan, you said last night that you were able to find something you called, quote, common ground. Was it common ground beyond the abortion issue, or was it really this concern that people really wouldn't remember that legislation from 4 years ago?
Well, I think it was about the discussion on abortion about federal funding, and recognizing that there are private plans that do provide that service.
And that's okay with you, right?
For women.
I mean,
they're a private plan, yeah. They can do what they want. Our concern is that the public money is not used to fund it. So there's got to be a firewall between the public subsidies and what they're calling the credits now in the exchange. There needs to be a direct firewall. That money is walled off. Any reimbursements or any money that's paid for those services needs to be with private money. So people are still coming with private money to all of these different plans. There's shared responsibility here. But it's that private money that must be used. And I think that's probably where 80 or 90% of the American people are.
Cece, I guess I was naive enough to think that we would all sort of stay on message, and I mean that as all Americans talking about health care, but there are two hot-button topics, abortion being one of them, and euthanasia that has sort of sneaked into the conversation over the last week. And I think we, at least as a physician, I think we've just sort of confused the end of life and how we spend our money with the idea that we're going to start pulling the plug on people. So we sort of have issues of life and death on both extremes.
Right.
Do you think that's right?
Well, I don't know if it's right or not, but I'm glad you brought this up. And a little plug, we have a story on this that you'll be able to read at WashingtonPost.com shortly, because there is some enormous misinformation out there right now about what this legislation might do around end-of-life care. Simply put, it says that a doctor who counsels a Medicare beneficiary about something like a living will would be reimbursed for that counseling session. Maybe a 30-minute conversation with your doctor would now be paid for. But this has turned into things like kill granny, euthanasia. It's really becoming a very extreme, very terrifying circumstance. AARP, the seniors group, is being flooded with very scared senior citizens who are hearing this on the blogosphere. And so we really need to clear up. This is about counseling session between a doctor and a patient.
Congressman, what are you going to take home? What message will you take home to your constituents in Ohio over the August break?
well, we need health care reform, but if I could just go back, there's obviously, and I commend the Washington Post for helping clear this up, there are some people who just don't want health care reform, and they're trying to do anything, to try to undermine the reform. And at first it's federal funding of abortions, then it's euthanasia. I mean, come on, who is going to want to pass a health care bill that's going to, pull the plug on your parents or grandparents? It's absolutely ridiculous. But the message going home is we need health care reform. If we do nothing, it means $1,800 increase for a family of 4 next year, and then more the following year, and this will just compound to where families aren't going to be able to afford insurance. If we don't bend the cost curve through this reform, then families are going to continue to go bankrupt. And we know that half of the bankruptcies now are due to health care costs and catastrophes that happen. So we need this to happen. The cost of doing nothing is too much. And no matter what these other folks are saying, trying to scare our senior citizens or scare people on the abortion and federal funding issue, they're trying to undermine the program. They're the same interests that have been trying to undermine this over the last 10 or 15 years. So we got to stay on message and communicate to the American people that the cost of doing nothing is just too much.
Well, I sure have big hopes that we can stay on message over the next month, because I think the ad wars are going to become a huge distraction. Congressman Tim Ryan, Ohio, thank you so much. And Cece, always great to see you.
Thank you.